Hello and welcome back to Simple Social Sciences. Today we have our final session on the Schizophrenia series and we're looking at the interactionist explanation and treatment for schizophrenia. By the end of the session you should be able to do the following. Outline the interactionist explanation, outline the interactionist treatment, and finally assess the strengths and limitations of the interactionist explanation for schizophrenia. So an interactionist explanation is one that we've already come across before but not quite looked at it as a separate approach. An interactionist explanation acknowledges that there are a broad range of factors that contribute towards developing any disorder. This includes a combination of biological and psychological factors, and more importantly, it considers how an interaction between these factors leads to the development of schizophrenia. The diathesis-stress model is an interactionist approach to explain behaviour. According to this model, schizophrenia is the result of an underlying vulnerability, which is the diathesis, and a trigger, which is the stressor. Both of these are necessary in order for schizophrenia to develop. In early diathesis-stress models, the diathesis was always genetic, so there was always a genetic vulnerability, and this genetic vulnerability came from a single schizo gene. So no amount of stress, according to this early model, can cause schizophrenia without that schizo gene. In carriers of the gene, chronic environmental stress, such as a schizophrenogenic mother, would trigger the schizophrenia. More recently, the diathesis-stress model has a different understanding of both diathesis and stress. When looking at diathesis, we consider the vulnerability. While recent research has shown that there is no single schizo gene and that schizophrenia is actually polygenic. Furthermore, the vulnerability isn't always genetic. It could be psychological trauma. For example, Reed et al. Found early trauma affected early brain development, particularly HPA systems, which were found to become overactive and led to more vulnerability to stress. Additionally, when looking at stress, recent diathesis-stress models would argue stress is not always psychological. Stress can be defined as anything that risks triggering schizophrenia. It was found that cannabis usage made it up to 4 times more likely to trigger a schizophrenic episode. This could be because it interferes with dopamine systems. An interactionist approach to treatment considers both biological and psychological factors, as according to the interactionist approach, the cause of schizophrenia is a combination of both factors. The approach combines antipsychotic drugs and psychological therapies. This is a more common practice in the UK. However, in the US, it's more common to prescribe drugs only. When evaluating interactionist explanations, there are actually multiple strengths. There is supporting evidence for the role of vulnerability and triggers. For example, Tinari et al. Looked at a combination of genetic vulnerability and parenting style and found high expressed emotion was linked to schizophrenia only in children with high genetic risk. So this increases the validity of the interactionist explanation. There's further supporting evidence for recent models. Houston et al. Found childhood sexual trauma emerged as a vulnerability factor, whilst cannabis use was a trigger. So we had the opposite. The vulnerability was a psychological issue, whilst the trigger was cannabis use. This supports the idea that psychological trauma can also be a vulnerability, which increases the validity of the explanation. A further strength is that it can explain individual differences, especially where same or similar genes are involved. For example, monozygotic twins who share 100% of their genes but don't share disorders, such as schizophrenia, can be explained with interactionist models. This is because whilst both twins have inherited the same genes, they experience different interactions within the family, different stressful life events, or even different prenatal environments. This means that the diathesis may be triggered in one twin but not in the other, which means the approach can be generalized. When looking at interactionist therapies, there is plenty of supporting evidence to show that it's the most effective method. Tarrio et al. Randomly allocated 315 schizophrenic patients to medication and CBT, medication and support group, or a control group which just had medication only. It was found that the 2 groups that had combined psychological interventions and medication showed reduced symptom levels compared to the control group. This clear advantage shows that interactionist therapies are better than biological therapies alone, and actually it's an effective approach to treating schizophrenia. This is an example of how your knowledge on this topic might be assessed. So Joel and Joey are identical twins in their mid-20s. The twins' mother suffered from schizophrenia. Joel has a good job, is married, and has never shown any symptoms of schizophrenia. Joey, however, has been recently diagnosed. He was made redundant and has been having relationship problems with his girlfriend. Discuss the importance of an interactionist approach in explaining and or treating schizophrenia, and refer to both Joel and Joey in your answer for 16 marks. You can find a step-by-step breakdown of how to answer this essay question. The links will be in the description for our Patreon and our podcast subscription. If you register, you can get instant access to these tutorials, as well as model essay plans and model essays written by an experienced psychology teacher. You will also have access to exam support based on requests made by you, live revision sessions, and plenty more. Don't forget to follow us on our socials for Instagram and TikTok at MissJ_Miss for any important updates, as well as our YouTube and Spotify, Simple Social Sciences. Links for our Patreon and Anchor subscription, as I mentioned before, will be in the description. We've reached the end of our schizophrenia topic. We have looked at the issues relating to validity, reliability when diagnosing schizophrenia. We've looked at biological explanations and treatment, psychological explanations and treatment, and interactionist explanations and treatment. Don't forget to revisit these videos as part of your revision when you're approaching your end of topic test or mocks. And give this video a like if you're watching on YouTube, because you'll be able to help us out and other students out who need help summarizing their A-level psychology and sociology content.